Good. Hey, what's up guys? Dr. Biondillo from Bodywork Clinic, and today we have Kaylee, and she was kind enough to let us do some examples and show some examples of what actually takes place during an adjustment. And a few things I want to cover and a few concerns I want to make sure that I touch on are, number one is what is that cracking noise, and that cracking noise scares me. And then secondly, a lot of people are concerned about, is it dangerous or is it safe? So I want to make sure that we touch on those two things and cover those in depth, and so that you can understand and understand that it's completely safe and it's an awesome experience. So come on over here, let's take a look. So one of the biggest misconceptions is that things are cracking, all right? And you have to understand what is actually taking place and understand that nothing's actually cracking. So when you have vertebrae or when you have a joint, for this example I'm going to use the spine, but this can be applied to any joint in the body. But when you have things that are misaligned or subluxated, which is a common term that's used, and that basically means that it's slightly less than a dislocation, or it's out of place, okay? So for the spine, let's use this example, and you can see here that this subluxated vertebrae creates a pocket. So when things are out of place, naturally, within the joints above or behind it or to the side of it, there's going to be a pocket that's created. And that pocket gets filled up with nitrous oxide and different gases that are just floating around our body. And naturally, when I go to put it back in place, the friction pushes the gas out of the pocket and it creates an audible. So nothing's actually cracking. And so it's something you have to understand. And another thing that I want to address is that a lot of people think that they see the action movies and they see you come up from behind and they turn your head real quick and all of a sudden the guy falls over. Well, that first of all is a myth, and it can't really happen that easily. You have to turn someone's head around 360 degrees for it to actually happen. So all those movies, I hate to say it to you, but that's a myth. So, but let's take a look at Kaylee, and I'm gonna go ahead and have her go face up. Lately she's been dealing with some headaches and some neck pain, and she typically has those subluxated vertebrae right at the top of her neck. So we're gonna look at those today and take care of those. So let's just go right here. Good. Same thing here. Good. And so for headaches, another little trick that you could do, right at the base of the head, there's little muscles that are called the suboccipitals. And you just do a little bit of trigger point therapy right on these muscles, and you just allow the weight of the head to just rest right on your fingers. How's that feel, Kaylee?
Feels great.
Good. So you could just press and hold here for about 30 seconds at a time, and it really relieves a lot of pressure right at the base of the head where a lot of those headaches start, those tension headaches. So, good. Okay, come on up, see how that feels. How's it feel?
Much better.
Good. So I hope that helps, guys. I hope that was a good example to show what actually takes place during adjustment and what the cracking noise is. And if you have any questions, be sure to message us, comment, like, share, and tag. Like our stuff. Be able to follow all this stuff, and you can learn little cool things like this. Thanks a lot. Bye.